Migraines can be more common during travel for a variety of reasons. The stress of travel in and of itself sometimes can provoke migraines. Traveling through airlines in particular sometimes limits people's ability to drink fluids, right? You can't take it through security now, or even eat regularly. You're seated on the plane for a while before they bring you food, before they allow beverage services. So there are definitely stretches where you may become dehydrated, where your blood sugar may become low, which can trigger migraines. And then in general, depending on the reason you're traveling, sometimes the environmental triggers from where you go can be a provoking factor, sometimes dietary factors, sometimes stress, depending if you're traveling for work, can be a provoking factor as well. And then sleep deprivation, if you're taking long trips, sometimes can be a very big factor for people. When you're traveling, you should definitely have on you a migraine kit, maybe an acute medication you can take if you're susceptible to nausea, an antiemetic or nausea medication. And sometimes it's actually useful to have a sleep aid on you as well. An eye mask that will just help you rest and sleep when you're traveling. It can be helpful to have earplugs to kind of drown out the sound around you when you're traveling. Wear comfortable clothing, to have something for neck support when you're traveling, to have water on you, and a little bit of a snack as well. I think in general, when you're planning a trip, it's important to have a conversation with your doctor before you go so you have some steps outlined in terms of what to do should you have a severe migraine during your travels. Particularly when you're traveling abroad, it may be difficult to obtain migraine medications that successfully treat your migraine and work for you. I've definitely worked with patients sometimes to even have them take a medication kit with a little letter just outlining what they have in case the airlines have any question about it. We do have a number of patients who sometimes have their regular acute treatments, but kind of what we call their heavy-duty acute treatments for when they have a very bad migraine. And sometimes we'll tell them, just have this in your kit as you go, just in case. And, if it comes to that, you can use it, or if you feel uncomfortable, maybe contact us and we'll tell you it's okay to go on and take it if need be.